this recording. Okay, so we were discussing about the lateral and the medial plantar nerve, how they are coming from the tibial nerve and going to give the major supply to the sole. Besides this major nerve, some other branches, some other smaller branches from other nerves are there which are going to give the innervation in the sole, mainly the cutaneous one. But the muscular supply of this sole, all the intrinsic muscle which are originated in the sole and having a insertion in the sole, they are going to be supplied by these two terminal branches of the tibial nerve, and the extrinsic muscles which are coming from the back of the leg, they itself get nerve supply by the tibial nerve within the back of the leg. Only the tendon of those extrinsic muscle are present in this sole region. So if you look it over there, this was the slide in my previous discussion where we have identified the tibial nerve, and we have discussed how tibial nerve starts by the bifurcation of the sciatic nerve into the common fibula and the tibial, and how tibial is going to end near the ankle joint into the two terminal branches, the lateral plantar nerve and the medial plantar nerve. And these two terminal branches goes to the sole and going to give the innervation in the sole mainly by these two terminal branches of the tibial nerve. I have also discussed about the medial calcaneal branch, which is going to give the innervation into the weight bearing area of the heel. So in the sole, the heel area is going to be innervated by this calcaneal branch. So that we have discussed in our previous session. Now, if you talk about the objective, what we have to do in this session, we have to identify the cutaneous branches, or rather we have to identify the area, which is area in the sole, which is going to be innervated by these cutaneous branches. And these cutaneous branches are medial calcaneal nerve, the cutaneous branches from the medial and lateral plantar nerve, how these cutaneous branches further having division into the proper and common digital nerves, and some other smaller branches which are coming from the sural and the saphenous nerve. And they are going to give the innervation, the cutaneous innervation in the sole. Besides the cutaneous branches, we have to identify the muscular branches or the muscles, how the muscle of the soles are going to be supplied by the medial and the lateral plantar nerve. These are the two small objectives which we will achieve after finishing this session. So if you talk about the sole, as Kishore told you, that whenever we are going for the dissection, we have to remove the skin and the superficial fascia. And in the sole, what we can see the plantar aponeurosis once we will remove the skin and the, say, on this region where this is the superficial region, just assume it. So in this region, if there is a in this region there is a skin and the superficial fascia, so from that superficial to the deeper aspect, if we start going to dissect, we'll get the muscles in the deeper layer. That's how he represented in his session, that how the muscles are arranged in the four layers, right? The first layer having one flexor and the two abductors, and the third layer having one adductor, two flexors, and the second layer having the one flexor digitorum accessorius, the long tendons of the flexor digitorum longus along with the lumbricals, and the flexor hallucis longus. So I'm not going to discuss about these muscles, how they are coming, how they will appear, but as I told you earlier, that to identify the nerve, you must aware how to identify the muscles in that region. If you would be able to identify the muscles, bony landmark, then you can identify easily the nerve because they are running in between them. So if we are going to dissect this region, or we can say the sole, there are four layers. So if we are going to dissect the first layer, and this first layer which is formed by these two abductors and the flexor digitorum brevis, so if they are going to be removed along with the plantar aponeurosis, we would be able to see the terminal branches of the tibial nerve and the medial lateral plantar nerve. So like if you look at the sole after removing the skin, it would be, or removing the skin or the plantar aponeurosis, it would be difficult to see the terminal branches. As we know, the tibial nerve in the back of the leg is a deeper nerve, right? So the branches, the terminal branches which are emerging from it, they are also deeper. So we have to reflect some layer of the muscle to identify these terminal branches. Once after removing this first layer, we would be able to identify the nerves. Then we can trace the branches from this nerve which are going towards the superficial aspect. As it is going to the superficial aspect, so most of the branches are going to supply the cutaneous innervation, and some of the branch will give supply to the muscles of the first layer. Now, if we go further towards a deeper aspect to dissect the other layer, like the second layer, third layer, and the fourth layer, if we dissect these layers one by one, then we can see at each step some of the branches which are going to the muscles of the deeper layer, and the articular branches from these medial and lateral plantar nerve which are going to supply the different joints. So basically, to identify the nerve, we have to dissect the superficial fascia, the plantar aponeurosis, and the first layer of the muscle. Then only we can see the terminal branches, right? Now, we start with our first objective, that is the cutaneous nerves in the sole. So, as you can see over there, this is the right foot sole, which is shown over there, and that is marked by 5 different color. If we give them some arbitrary number, we can see the 5 different area there, right? And correspond to this image, we can see in this image that there are certain nerves which are going to innervate these different area which are colored in the first diagram by the different 5 numbers. So if we try to identify these nerves, or if we want to say uh, locate the area, or we want to decide which area is going to be supplied by these nerves, so we'll start by we can see each and every nerve and we can identify it very easily. You can see this pink area which is designated over there by number 1, that is going to be supplied by the medial calcaneal nerve, right? And we have discussed earlier that the medial calcaneal nerve is a cutaneous branch which is coming from the tibial nerve. Before the tibial nerve divide into the 2 terminal branches, those are the medial and the lateral plantar nerve. Now you can see in the sole there are 2 major nerves which are coming. One is going towards the medial side, one is going towards the lateral side. So these are the medial plantar nerve and the lateral plantar nerve. So in the maximum area of the sole, on the medial three half in respect to the these toes, you can see the 3 half of the toes, and the corresponding this medial area is going to be supplied by this medial plantar nerve, and the lateral 1/2 toe and this area is going to be supplied by the lateral plantar nerve. How it is going to supply, we will discuss separately after identifying the medial and the lateral plantar nerve, right? But you can see the 2 terminal area, one is towards the lateral side and one towards the medial side, or we can say the marginal area. They are going to be supplied by other nerves which are going to supply, which were supplying the different area of the leg, right? So here the lateral most terminal area was supplied by the sural nerve, and here you can see the medial most terminal area is supplied by the branches from the saphenous nerve. Now, if we discuss how these nerves are coming, there is a chart. So, the medial calcaneal nerve was coming from the tibial nerve in the leg, in the lower region of the leg. The medial plantar and the lateral plantar are the terminal branches of the tibial nerve, which enters into the sole, and the branches of sural nerve. So we know sural nerve is emerging from the tibial nerve at the popliteal fossa level, or at the superior aspect of the, or at the proximal aspect of the back of the leg. Then it runs deep to the deep fascia. Then it emerges in the lower part of the back of the leg and communicates with the communicating branch of a fibular nerve. Then it gives supply to the back of the leg, and in the some part over there you can see the marginal area on the lateral side of the sole. Similarly, the medial most area, just in front of the medial malleolus, this marginal area on the medial side of the sole is going to be supplied by the saphenous nerve, and we know saphenous nerve emerged from the posterior division of the femoral nerve. So that's how the branches from these 5 different nerves are going to innervate this whole sole, and they give the cutaneous innervation in this sole region. Now, besides the cutaneous nerves, if we look at the main branches or the terminal branches of the tibial nerve, that is the medial and the lateral plantar nerve. So how this medial and lateral plantar nerve gives the cutaneous and the muscular branches, to see the emerging of these branches, or to see or to visualize the main trunk of these terminal branches, we have to dissect the foot. So if we start dissecting the foot, what you can see in this schematic and the dissected image of the atlas, the skin has been removed, the superficial fascia has been removed. Now you can see some of the cutaneous nerves in this region. Okay, you can identify the plantar aponeurosis also, right? So this is the plantar aponeurosis. And if you look at the schematic diagram, what we can see the two muscles which belongs to the first layer of the sole. The first layer of muscles of the sole, these are abductor hallucis towards the medial side and the abductor digitum minimi towards the lateral side. The third muscle of this first layer is a flexor digitorum brevis, which is not visible over there because that is under the plantar aponeurosis. Now if we are going to cut this plantar aponeurosis, we can see here now the three muscles. This is the cut end of the plantar aponeurosis, and you can see the three muscles in this region. From the medial to lateral, from the medial side, this is the abductor hallucis towards the great toe, and this one is a flexor digitorum brevis, which was not visible over there because that was deep to the plantar aponeurosis. Now between these two muscles, you can see this yellow nerves emerging, and these are the medial plantar nerve. So to identify the branches of the medial plantar nerve or the main trunk of the medial plantar nerve, we have to identify these two muscles. So these two muscles are keys to identify the medial plantar nerve. One is the abductor hallucis, another one is the flexor digitorum brevis. Now if you look at the lateralmost muscle in the first layer, this is the abductor digitum minimi. Now between the abductor digitum minimi and the flexor digitorum brevis, you can identify this lateral plantar nerve or the branches from the lateral plantar nerve. So again, to identify the lateral plantar nerve, the key is abductor digitum minimi and the flexor digitorum brevis. So as soon as you will identify the muscles in the first layer after reflecting the plantar aponeurosis, you can see some of the branches of medial and the lateral plantar nerve and their trunk in this region. So now if you look at the this prosected specimen of atlas, you can see the three layers after reflecting this plantar aponeurosis. Here you can see the three layers, three muscle of first layer, that is the abductor hallucis, abductor digitum minimi, and flexor digitorum brevis, right? So three muscles of first layer are there. Now you can see between the abductor hallucis and the flexor digitorum brevis, there are branches which are emerging from the medial plantar nerve, as we have seen over there. So this is the abductor hallucis, flexor digitorum brevis. In between there is a medial plantar nerve. Similarly here between the abductor hallucis and the flexor digitorum brevis, you can see the branches from the medial plantar nerve. So if you would be able to identify these two muscles in the sole, you can easily identify the nerve in this region along with the vessels. So vessel will be discussed in the next session. And on the lateral aspect, you can see the abductor digitum minimi. So between the abductor digitum minimi and the flexor digitorum brevis, you can identify the lateral plantar nerve or the branches from the lateral plantar nerve. So to identify the main trunk or the branches, we have to identify these three muscles of first layer in the sole, right? Okay. So if we move further, if you want to see their main trunk, how they are coming from the tibial nerve, we have to cut these two muscles, the flexor digitorum brevis and the abductor hallucis. As we know, these both are coming from the medial side. So if we are going to cut it, here you can see what the flexor digitorum brevis has been cut, and this is showing the abductor hallucis, which has been cut in this region, right? So once these two muscles have been cut, you can see the tibial nerve and how this tibial nerve is going to be divided into the lateral plantar nerve and the medial plantar nerve. So now if you look at this prosected specimen again, here the abductor hallucis have not been cut, but the flexor digitorum brevis has been cut. So you can see now the nerve trunks or the trunks of the medial and lateral plantar nerve. So here this trunk is a medial plantar nerve. This is the medial plantar nerve. The trunk is deeper to this flexor digitorum brevis or the abductor hallucis. So if this muscle is present in this region, we can only see the branches. So we can see the branches. These are the different branches which are emerging from this medial plantar nerve. Now, if you look at all these branches, their trunk are more deeper to the abductor hallucis. So we can see some branches over there. They all are coming from the lateral plantar nerve, and they are showing the different branches which are coming from this lateral plantar nerve. So first, by identifying these three muscles, we can identify or we can differentiate the branches of medial and lateral plantar nerve. Then after reflecting the flexor digitorum brevis, we can identify the main trunk of this lateral and plantar nerve. Okay, so in this image, this is the prosected specimen of our department. So what we can identify in this region, in the superficial fascia and the plantar aponeurosis has been removed. So we can identify three muscles. In the midline, you can see this is the flexor digitorum brevis, and on the medial side, you can see the abductor hallucis, and between these two muscles you can see this nerve which is emerging between it. So these are showing the branches or the main trunk of the medial plantar nerve. So that's how you have to identify the medial plantar nerve. You have to identify first this flexor digitorum brevis, then the abductor hallucis, then in between them you have to identify this medial plantar nerve. Now on the lateral aspect, you can see the abductor distal. So between the abductor distal and the flexor digitorum brevis, the nerve structure which is present over there, that is the lateral plantar nerve. Okay. So now onwards, we will discuss about this medial and lateral plantar nerve individually. If we talk about the medial plantar nerve, you can see how the tibial nerve is divided into the medial and the lateral plantar nerve. So we are going to discuss about this medial plantar nerve part, right? So our focus is this medial plantar nerve now, right? So what we can see, this medial plantar nerve here divided into these certain branches which are going to the digits. As they are running towards a digit, they named as the digital branches, right? Now what we can see again over there, the medial plantar nerve here is going to divide into these digital branches, but the main trunk of this medial plantar nerve, before giving these digital branches, in the proximal region, it gives some branches to the muscle of this, the muscle of the first layer of the sole. And these muscles are the abductor hallucis and flexor digitorum brevis, right? So these two muscles are going to be innervated by the branches from the medial plantar nerve, or we can say the main trunk of the medial plantar nerve before it gives the digital branches. Along with that, it also gives some branches in this region to supply the joints, the tarsometatarsal joint and the metatarsophalangeal joint. So before giving the digital branches, it is going to give the innervation to the two muscles, the abductor hallucis and the flexor digitorum brevis. And these two muscles belong to the first layer of the sole, right? Now, if you look at the digital branches, we can see this one branch which is running towards the medial side of the great toe. It is named as the proper digital nerve, while the rest branches are known as the common digital nerve. We'll discuss why they named as common digital. First, look for this proper digital nerve. You can see it is running towards the medial side of the great toe. So it is going to give the cutaneous supply to the medial side of the great toe, and in its course, it gives a muscular branch to the muscle in the third layer of the sole. As we have discussed, in the third layer, there are two flexors and one adductor. So on the medial side, there is one flexor, that is the flexor hallucis brevis. So that flexor hallucis brevis is going to be innervated by the branch of this proper digital nerve, which is coming from the medial plantar, right? So the branch proper digital nerve gives cutaneous innervation on the medial aspect of the great toe and give one muscular branch to the flexor hallucis brevis. Now, if you look for these other three branches, which we named as a common digital nerve, they named as a common digital nerve because if you trace one of the branch, like if you trace this first common digital nerve, we can see it is again divided into the two branches and they are going to the different toes. So this common digital is again divided into the proper digital nerves. So these proper digital nerve which are coming from this common digital nerve, they are going to innervate the area adjoining between these two toes, right? So each common digital sorry. So each common digital, like 1, 2, 3, these common digital are going to divide into the proper digital nerve, and they give the cutaneous innervation in the adjoining area between the toes. So like the first one is going to innervate between the first and second toe. The second one is between second, third, and the third one is between the third and fourth toe. Now, the first common digital nerve also gives innervation to the first lumbrical muscle. The lumbrical belong to the second layer because it having an attachment with the long tendon of the flexor digitorum, which belongs to the second layer. So, the proper, if you talk about the proper digital, this proper digital along with the cutaneous innervation gives muscular supply to the flexor Holosis brevis, and the first common digital along with the cutaneous innervation gives supply to the one muscle, that is the first lumbrical. So till now we have seen the medial plantar nerve gives innervation to the fore muscle. The main trunk gives innervation to the abductor holosis, flexor digitorum brevis. The proper digital nerve gives innervation to the flexor holosis brevis, and the first common distal gives innervation to the first lumbrical muscle, right? So four muscles are going to be innervated by these medial plantar nerve or by their branches. Now all these common distal, when divided into the proper digital along with the cutaneous innervation, they give some branches to the interphalangeal joints to supply those joints as an articular branches, and they also give cutaneous innervation towards the dorsal aspect. If you look at the dorsal aspect, this is the plantar aspect. So if you look at the dorsal aspect, the three half of the fingers nail bed, or the skin around the nail bed of three half of the finger, they are going to be supplied by or innervated by these proper digital nerve, which are coming from this medial plantar nerve. So again, in this image, what you can see, this is the abductor holosis and the flexor digitorum brevis, and you can see how from the main trunk the branches are going to give supply to these two muscles of the first layer before it gives these digital branches, right? So before dividing into the digital branches, the proper and the common digital, it gives innervation to the abductor holosis and the flexor digitorum brevis. Now this is the prosected specimen of the department. Here you can see there is the abductor holosis on the medial aspect, abductor distal minimi on the lateral aspect, and this muscle, this is showing the flexor digitorum brevis, which was earlier present in this region, but here it has been cut and reflected towards the posterior aspect. So now you can see the nerve structure over there. So this nerve which is running towards the lateral side, this is representing the lateral plantar nerve. But if you look at these branches, this one and this one, they are further divided over there. So one single which is coming over there is a proper digital, and this one is further divided into these common digital. So here you can identify these digital branches from the medial plantar nerve, how they are emerging from the common trunk which is present in this region, right? So in summary, what we can say that if we talk about the cutaneous innervation, so medial side of the great toe, medial 3.5 of the sole, including the 3.5 of the toes, and the adjoining area between first to fourth toe, they are going to be innervated by the medial plantar nerve. Only the four intrinsic muscle of the sole are innervated by the medial plantar nerve. These are abductor holosis and flexor digitorum, which were innervated by the main trunk of the medial plantar nerve. Flexor holosis brevis, which was innervated by the branch from the proper digital nerve, and first lumbrical, which was innervated by the branch of the first common digital nerve, and these digital nerves are the branches of this medial plantar nerve. And also these nerves give the articular branches to the torso-metatarsal joint, metatarsophalangeal joint, and interphalangeal joints. So that's how this area or these muscles are going to be supplied by the medial plantar nerve. Now if you talk about the lateral plantar nerve, so to focus on the lateral plantar nerve, now we have to focus on the two muscle, that is the flexor digitorum brevis and the abductor distal minimi, because in between them there is a lateral plantar nerve. So same in the prosected specimen image of atlas, you can see the flexor digitorum brevis, abductor minimi, and in between them you can see the branches from the lateral plantar nerve. Now again, if you want to see the main trunk, we have to cut these muscles. So if we are going to cut the flexor digitorum brevis, abductor hallucis, then you can see this lateral plantar nerve. Now you can see this lateral plantar nerve is running over a muscle of second layer, which is pulling this flexor digitorum longus, and this muscle is flexor accessorius or the quadratus plantae. So we can say if this flexor digitorum brevis is intact, this lateral plantar nerve is plastered in between these two muscles. So it is running between the muscles of two layers. In the first layer, there is a flexor digitorum brevis, and in the second layer, there is a flexor accessorius. So its main trunk is passing, or the most of the branches are passing over or superficial to this flexor accessorius muscle, which is also known as quadratus plantae. So now here you can see this is the flexor digitorum longus. So to pull this flexor digitorum, you can see this muscle which is deeper to these nerves. This is the flexor accessorius, right? And all these branches which are running over the flexor accessorius, they are coming from this lateral plantar nerve. So the nerves which are passing over this flexor accessorius, you can identify them as the branches from the lateral plantar nerve or the main trunk of the lateral plantar nerve. Here the main trunk is divided into these branches much before this flexor accessorius, and it is giving certain branches in this region. So if you want to identify these branches, the main trunk before running or when it is passing over this flexor accessorius, means between the first and the second layer. As you can see, there is a first layer, the cut end of the flexor digitorum brevis, and the second layer is flexor accessorius. So it is passing above the flexor accessorius. So main trunk, before dividing into the main branches, it gives some branches towards the muscles which are present in this proximal region, and these branches are these branches are going to the muscles abductor disti minimi and the flexor accessorius. So abductor disti minimi, the lateralmost muscle of the first layer, and the flexor accessorius belongs to the muscle of second layer. So these two muscles are going to be supplied by the main trunk of the lateral plantar nerve, like the abductor hallucis and the flexor digitorum brevis were supplied by the main trunk of the medial plantar nerve. Now you can see these smaller branches. You can see one of this branch which is going towards this abductor disti minimi. So this is the muscular branch to abductor disti minimi, which is coming from the main trunk. Now if we leave this branch, what we can see as the main branch was going to supply these two muscles and the cutaneous innervation to the lateral margin of the sole, the main trunk is going to be divided into these two branches, and these two branches are named as the superficial and the deep branch. Now you can see this deep branch is going towards a deeper aspect, and we can see the superficial branch how it is dividing into the further two branches, right? So to identify the superficial and deep branch, it is easy because they are passing above this flexor accessorius, and their diameter or their thickness is almost all equal to the medial plantar nerve. So you can easily identify this superficial and the deep branch. Now, if we talk about this superficial branch, if we focus on this superficial branch of the lateral plantar nerve, you can see it is divided into one lateral and one medial branch. These two branches are coming from this superficial branch of the lateral plantar nerve. Now, if you look at this lateral branch, this is the proper digital nerve, like the proper digital nerve of the medial nerve. So this is the one proper digital nerve which is going to give further other branches. Now this one proper digital nerve give the supply towards the lateral side of the little toe, and also give the muscular supply to some muscles in this region. So lateral side of the little toe is going to be supplied by this the proper digital branch, which is coming from the superficial branch of the lateral plantar nerve. It also gives the muscular innervation to the muscle in a third layer, that is a flexor digiti minimi brevis, as there the first proper digital of this medial plantar nerve was giving the medial side of the great toe, the cutaneous innervation on the medial side of the great toe. Along with that, it was giving a muscular branch to the third layer, that was the flexor hallucis brevis. So on the lateral side towards the little digit, there is a muscular branch which goes over there and gives supply to the flexor digiti minimi brevis, and it gives also branches to the interossei muscle which are present in the fourth intermetatarsal space. As we know, the interossei are present between the metatarsals. So between the fourth intermetatarsal space, both dorsal and plantar interossei, they are going to be innervated by the branch of this one proper digital nerve which is coming from superficial branch. Okay, now if you look at the common digital, this common digital is similar to the common digital branch of the medial plantar nerve. So it is again going to divide into the two proper digital, and they are going to give the supply to the area between the little toe and the foretoe, and sometimes they give the communication branch towards this third common digital nerve of the medial plantar nerve. So it is similar to these the common digital nerve of the medial plantar nerve, but this one proper digital nerve, it gives branches to the muscles also along with the cutaneous innervation, right? Okay, so we have discussed about these main trunk, how the main trunk is going to give supply to this flexor accessorius, abductor disti minimi. Then how the superficial branch, this is a superficial branch, gives common digital and proper digital, and this proper digital how gives supply to the other muscles. But if you look at this branch, this is the deeper branch. Now we can see this deeper branch is going deeper to the muscle of this second layer, right? Now, if we are going to dissect this second layer muscle, then only we can see how this nerve is going deeper to this muscles and where it is going to be terminated, right? So after removing this second layer muscle, that is the flexor accessorius and the flexor digitorum longus. Now what you can see, the third layer muscle on the medial most, there is a flexor hallucis brevis, flexor yes, flexor hallucis brevis, flexor digiti minimi brevis, and you can see this muscle, this is the adductor hallucis. This adductor hallucis showing the oblique head, and these are their transverse head. So this whole muscle is a adductor hallucis. So this is the oblique head of the adductor hallucis. So this nerve which is going deep to the second layer, it also passes deep to the third layer, that is the oblique head of the adductor hallucis. So it goes deep to this muscle. So once it goes deep to this muscle, it is going to supply this muscle, and the muscle belongs to the fourth layer. So now if you talk about the muscle in the third layer, these muscles, the flexor hallucis brevis, that was supplied by the uh, branch of the medial plantar which was giving the supply to the great toe, or the medial side of the great toe, that was the first proper digital nerve, and this was supplied by the superficial branch, right, of the lateral plantar nerve. Now deep branch is going deep to this, so they are going to supply the oblique and the transverse head of the adductor hallucis, and the muscle which are lying deep to it, those are the interossei. So all the dorsal and the plantar interossei are going to be supplied by this deep branch of the lateral plantar nerve, except the interossei which are present in the fourth intermetatarsal space, because we have discussed earlier here the the proper digital of this lateral plantar, superficial branch of the lateral plantar, that was supplying the intermetatarsal muscles in the fourth space, right? So here this deep branches only give innervation to the interosseous muscle which are present in the first, second, and the third space, not in the fourth space. So this is the prosected specimen where you can see the flexor digitorum brevis, you can see the flexor digitorum longus with lumbricals, and you can identify the lateral plantar nerve, the superficial branch, and the deep branch of the lateral plantar nerve. Now, in summary, the cutaneous supply, it is going to innervate the lateral margin of the sole, lateral side of the little toe, lateral side of the sole, including the adjoining area between the fourth and the little toe, and the muscles. So most of the muscles, except those four muscles which are supplied by the medial plantar nerve, all the intrinsic muscle are going to be supplied by this lateral plantar nerve, either by the superficial branch or by the deep branch. Now, if you talk about the applied part, you are aware, you must be aware of this plantar reflex that has been discussed in the physiology also. The plantar reflex corresponding to the L4, L5, S1, S2 nerve root, and this is a deep tendon reflex. In this examination, as you can see this first image, what clinician do, they stroke the sole by a blunt object, and they start stroking from the lateral aspect of the sole, from the uh, heel area towards the toe area, then they move towards the great toe. So during this stroking by the blunt object, in the reflex there is a flexion of the toes has been seen. So this flexion of the toes in response to this stroking of the blunt object, this phenomena is known as negative Babinski sign, and this is a normal response. But if there is an abnormality, in the abnormality there is a dorsiflexion of the great toe along with the slight fanning. Fanning means the spreading of these other toes, and the dorsiflexion of the great toe along with this spanning, that is known as abnormal response or the positive Babinski sign. And that Babinski sign indicated the brain injury or the cerebral diseases, except in the infant. In the infant, the Babinski sign is a normal sign. Now, if we talk about the nerve entrapment, the medial plantar nerve is more prone for this nerve entrapment. So in some of the gymnastic and the players who do the running regularly, in those people, the medial plantar nerve get entrapped deep to the flexor retinaculum or the abductor hallucis muscle in the sole. So they are going to be entrapped in this region. So due to that entrapment, there will be the aching, burning, or the numbness, or the tingling sensation on the medial side of the sole of the foot, where this medial plantar nerve is going to supply or give the cutaneous innervation. So as it is seen in the gymnastic people, it is also known as the jogger's foot. So that's all about the medial and plantar nerve. I'll take just 1 or 2 more minutes. So it is just to ask you some questions which we have discussed in this session. Okay. Okay, Mani, I'll make you the presenter. I'll just take 2 or 3 minutes. Okay. So you can see this is the sole of right foot, and I'm going to ask the certain regions which are going to be supplied by the different nerves. So some of you can give the answer if you want. So my question is this area, the lateral most area along with the three half of the toes. So this area is going to be supplied by which nerve? Okay, good. So that is by the lateral plantar nerve, and good. And what about this area? This area is going to be supplied by the medial plantar nerve. Okay. What about this pink area, the heel, weight bearing area of the heel? That is going to be supplied by the medial calcaneal branch. So this medial calcaneal branch is again coming from the tibial nerve. And the terminal area or the marginal area on the lateral side and the medial side, they are going to be supplied by these, the branches from the sural nerve and the saphenous nerve. Okay. Now, next question is the nerve supply of all dorsal and plantar interossei is by. So how the interossei muscles are going to be supplied? they are by the lateral except fourth, lateral plantar nerve. Okay, so the answer, okay, I'll discuss it. Answer is the lateral plantar nerve. Now, the thing which is except, so why it is coming in your mind? Because if you talk about the nerve supply of the dorsal and the plantar introsea in the fourth intermetatarsal space, that is also by the lateral plantar nerve, but the superficial branch, right? And rest of the intermetatarsal space, like the first, second, and the third, they are going to be supplied by the deep branch. Okay. Now, next question is nerve supply of lumbricals. So in the fourth space, the introsea was by the superficial, and in rest of the spaces, web spaces, that is by the deep branch. Lumbricals first by the medial plantar and rest by the deep lateral plantar. Good. So okay. So if somebody will ask you the nerve supply of the lumbricals, you will say it is going to be supplied by both medial and the lateral plantar nerve. If someone will ask you what is the nerve supply of first lumbrical muscle, so it is coming by the medial plantar nerve, or you can say the first common digital branch of the medial plantar nerve. And the nerve supply of second to fourth lumbrical, that is coming from the lateral plantar nerve or the deep branch of the lateral plantar nerve. So that's all. So you have to identify the muscles first, then only you can identify the main trunk. Then you have to see how these main trunk are divided into the mainly the medial, mainly into the proper and the common digital branches, and you have to remember how these branches are going to innervate the different muscles and how they give the cutaneous innervation to the different area of the soul. That's it. Thank you. If you have some question, you can ask.